November is Prematurity Awareness Month. In the past year, the Neonatal Intensive Care Unit at Helen DeVos Children's Hospital admitted more than 1,400 babies from 35 counties across the state of Michigan. Dr. Ed Beaumont is a neonatologist with the hospital and is joining us today. Good morning, doctor.
Good morning.
Yeah, so in the last year, 1 in 10 babies are born prematurely. That's quite substantial.
Yeah, it's a huge number. It's a big problem worldwide, but especially here in the United States and right here in Grand Rapids. We've never been busier. We have over 100 babies in our nursery right now today. Vast majority of them were born prematurely.
Yeah, so tell us about Helen DeVos Children's Hospital and especially the NICU. What makes it so special?
The state has different designations for the level of care that one can provide. We're the only level 4 center on this side of the state. The only other 2 in the state are in the Detroit area. So we can handle everything: surgical, heart disease, and all the complications of prematurity. It's a big unit. As I said, over 100 babies. We have a lot of wonderful staff, and we've been here for quite a few years with lots and lots of happy families that have experienced the care in our unit.
Yeah, when you hear that number 1 in 10, parents who are expecting a child in the near future, that is an alarming number. So, today we want to talk about some of the factors. So are there some factors that can lead to a premature birth?
So yeah, as you said, this can happen to anybody. And 90% of women in this country will have a baby at some point in their life. So almost any women out there that are listening could be impacted by this. Some of these factors are beyond your control. Some of them are within your own personal control. And the things that are all kind of tied together: poor health insurance, which leads to poor prenatal care, very often as a result of poverty and living in a rural area. So all those things kind of snowball and lead to a point where complications during pregnancy are sometimes not discovered early enough, and this can lead to an unfortunate circumstance where the baby comes early. Some of the medical problems that women can have are aggravated during pregnancy. So diabetes, kidney problems, heart disease, high blood pressure, the strain that the pregnancy puts on the woman's body very often will aggravate these things and sometimes forces the obstetrician to have to deliver the baby early because of concerns for the mother's health.
Yeah, so there are a lot of factors that can come into play. So are there any things that parents can do to help eliminate those risk factors?
So I think planning is the most important thing. Think about the pregnancy before you actually get pregnant. If you have some of those underlying health problems, getting those all sorted out, get your diabetes under control. If you've got high blood pressure, make sure you've maximized the control of that problem. If you're overweight, lose some weight before you get pregnant, and have a thorough checkup, I would say, before you actually get pregnant. Have 1 baby at a time. Sometimes that can be controlled, sometimes it can't. Most twins are born prematurely. That's one of the leading causes of prematurity, is multiple gestations. Age has a factor. Having a baby when you're less than 17 leads to a higher rate of prematurity. And having a baby when you're over 35, the rate of prematurity is much higher also. So if you've got the flexibility to plan your babies to a certain age range, you try to stick within that age range if possible.
Yeah, that's good information and things to think about. Doctor, how does the United States, along with Michigan and especially Grand Rapids, compare and measure up to the rest of the world when it comes to babies that are born prematurely?
Yeah, bottom line is we don't have anything to brag about here, unfortunately. The United States does very poorly in general. With that 10 to 12% rate that you mentioned earlier. The other countries that have the same rate, I think you'll be surprised. Afghanistan, Turkey, Thailand, Somalia, countries that you would think we would be doing much, much better than. Michigan, we get a C from the March of Dimes. The country in general gets a C. Michigan gets a C. Grand Rapids gets a C. So we're very, very average. There's only one state in the country that gets an A, and that's Oregon. There are several states that get Bs. Most of the country is average or below average in terms of expectations.
Wow, you nailed it right on the head. That is nothing to brag about here in Michigan. But you know, luckily we're very fortunate to have all of the fantastic work that is being done at the Helen DeVos Children's Hospital. And in the NICU is no different than any other department and unit that you have. So when you talk about your staff working with families that have been in the NICU, it's not a we work with you and then we send you on your way. It really is a journey. Can you talk to me about that?
Yeah, the journey starts at admission. About a third of our babies are not born at our hospital. We have a transport team that goes out and picks them up, and we're able to make that connection right at the very beginning. We now have video technology where once the baby gets back to our nursery, we're able to do a video conference with the parents so that they can get an idea what the unit looks like, how the baby's looking at that point. We got a chance to tell them how the transport went. That continues during the stay. We now have a number of video cameras that can be mounted over the baby's incubator or bed where the family can log in and they can watch and stare at their baby hours on end if that's what they choose to do. Just recently, the hospital added the ability to access the baby's chart remotely. So now parents can look at x-ray reports, they can look at our progress notes to see how we felt the baby was doing that day. And then after discharge, we keep in touch in the form of a family reunion. We do that usually every other year, and we have hundreds and hundreds of families that come back with their baby to show us how they're growing and developing.
Yeah, it really is like a family, and you keep in touch with these families as well. Thank you so much for shedding light and education on Prematurity Awareness Month and all throughout the year. If people want to learn more, where can they find more information?
So I think the March of Dimes website is a great place to start. The March of Dimes, a number of years ago, made their major commitment for their organization to lower the rate of prematurity. And they fund research for that purpose. So it's a wonderful organization. I'd start there. There are links there to other websites. I'd caution people to be careful where they go. I'd stick with university or children's hospital websites to get at least a start on getting good information about this problem.
Dr. Beaumont, thank you so much for your time today and everything that you and your staff do at Helen DeVos Children's Hospital.
You're welcome. Thank you.